Fight against HIV/AIDS. Presented by Group 4. Topics: Cause and effect of premarital sex. What is HIV/AIDS? Cause, symptoms, prevention, treatment, incubation period. Premarital sex. What is premarital sex? Premarital sex is penetrative vaginal intercourse performed between couples before formal marriage. What is the effect of premarital sex? The consequences and health impacts of unprotected sexual practices among young people include sexually transmitted infection, STIs, HIV, AIDS, unwanted pregnancy, teenage pregnancy, and abortion. Main topic: HIV. H. Human. I. Immunodeficiency. V. Virus. AIDS. A. Acquired. ID. Immunodeficiency. S. Syndrome. Causes. HIV. HIV is caused by a virus. It can spread through sexual contact, illicit injection drug use or sharing needles, contact with infected blood, or from mother to child during pregnancy, childbirth, or breastfeeding. It destroys CD4 T cells, white blood cells that play a large role in helping your body fight disease. The fewer CD4 T cells you have, the weaker your immune system becomes. Here's a breakdown. HIV is a virus that can be transmitted through certain body fluids, such as blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common modes of transmission include unprotected sexual contact, sharing of needs or syringes, and from mother to child during childbirth or breastfeeding. HIV damages the immune system by destroying CD4 cells, weakening the body's ability to fight off infections and diseases. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. What is AIDS? Acquired immunodeficiency syndrome, AIDS, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, HIV. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease. Symptoms. It's important to understand that symptoms of HIV/AIDS can vary widely, and some individuals may not experience noticeable symptoms for years. However, common symptoms include fever, fatigue, swollen glands, rash, sore throat, muscle and joint aches, headache, nausea and vomiting, diarrhea, weight loss. As HIV progresses to AIDS, more severe symptoms may appear. Persistent cough, shortness of breath, recurrent fever or profuse night sweats, chronic diarrhea, persistent white spots or unusual lesions on the tongue or in mouth, persistent, unexplained fatigue, unexplained weight loss, blurred or distorted vision. How HIV doesn't spread. You can't become infected with HIV through ordinary contact. That means you can't catch HIV or AIDS by hugging, kissing, dancing, or shaking hands with someone who has the infection. HIV isn't spread through the air, water, or insect bites. Prevention of HIV/AIDS. Safe sex practices. Use condoms consistently and correctly during sexual intercourse. Consider using pre-exposure prophylaxis, PrEP, for individuals at higher risk. Regular testing. Get tested and know your partner's HIV status. Encourage routine HIV testing, especially if engaging in high-risk behaviors. Medical male circumcision. Male circumcision has been shown to reduce the risk of heterosexual transmission. Treatment as prevention. Timely initiation and adherence to antiretroviral therapy, ART, can significantly reduce the risk of transmitting HIV. Mother-to-child transmission prevention. Pregnant women with HIV can take medications to prevent transmission to their infants. Practice to reduce drug use. Address substance abuse and promote harm reduction strategies to minimize the risk of HIV transmission through drug use. Treatment. There's no cure for HIV/AIDS, but medications can control the infection and prevent progression of the disease. Antiviral treatment for HIV have reduced AIDS deaths around the world, and international organizations are working to increase the availability of prevention measures and treatment and resource per countries. Incubation period. Between 1 and 6 weeks, median 3 weeks, after exposure to HIV, 1/2 to 2/3 of recently infected individuals develop a mononucleosis-like illness referred to as the acute retroviral syndrome. Without treatment, about half of infected adults will develop AIDS within 10 years after infection. Keep in mind that these symptoms can be caused by various conditions, and the only way to confirm HIV infection is through testing. Question time. Questions. 1. What is HIV? 2. What does AIDS stand for? 3. Give one prevention of HIV/AIDS. 4. Give one symptoms of HIV/AIDS. 5. How long is the incubation period of HIV/AIDS? Thank you.